Good morning, everyone. Welcome to our early bird webinar in partnership with Merck, Sharp, and Dumb. My name is Dwayne Schultes. I'm the Managing Director of Vital Transformation. I'd like to thank you for joining us today. Today's webinar will be discussing health literacy and cancer, taking the next steps. So before we begin, just a couple points for you. If you're having issues with your internet connectivity, if you're having problems with your bandwidth, you can push the little arrow next to the mute button on your control panel. This little menu will pop up and you can switch to the phone and dial in. Please feel free to do so, and we'll love to have you involved, so make sure you don't miss anything. And also, we'll be taking questions from you. We would love to circulate these to our panelists. Use the Q&A button in the task panel. Again, submit your question and I will circulate them to our panelists. Health literacy supports patients at every stage of their journeys. It helps them navigate decision-making and elevates patients to partners in the process. When combined with health literate institutions, health literacy can both improve patient care and help reduce unnecessary and inappropriate medical interventions. However, programs to increase health literacy have been notoriously difficult to implement, and COVID-19 shows the huge challenge that health literacy will face as even discussing facts these days reaches levels of dogma and orthodoxy. How can we return to a grounded debate and keep Europe's Beating Cancer Plan focused on improving clinical guidelines and implementing programs? What are the limits of centralized authority imposing health literacy programs, and what lessons must we draw from the current pandemic so we can do better? And I'm extremely pleased to be joined by two excellent speakers today. And if I can get them to turn on their cameras and join us now, I'd like to introduce you first to Ilona Kirkbush, the founding director and chair of the Global Health Center at the Graduate Institute of Development and Studies in Geneva. Ilona, thank you for joining us. It's a pleasure to see you.
Hello, good morning.
And of course, Francesca Colombo from the Health Division of the OECD. Francesca, always a pleasure. Good morning.
The pleasure is mine. Thank you.
So Francesca, I'd like to start with you. You lead much of the OECD work on health literacy, including the context of chronic conditions and non-communicable diseases. What are some of the key lessons learned so far, and what are the OECD's main area of activity right now in health literacy?
Sure. First, in terms of how we define, if you want, health literacy, it concerns not just the knowledge that people have of health and health system, but also the motivations, the skills, their ability really to understand, but also to act on that information. And I think that's a quite important point. There are three main issues, perhaps, to kickstart our conversation I would like to bring to the fore. The first one is the critical importance of health literacy in the context of broader system changes, which are geared towards making health system much more people-centered. So health system being about what people achieve in terms of their own health, about their outcomes, their experiences, and not so much or only about what providers can do. And it's clearly the skills that individuals have in being a partner in decision-making and in influencing their own health is a fundamental one. And there is clearly evidence that this works. It's not necessarily just the magic bullet, but this works. It can empower people, particularly those with chronic conditions, but we've seen also in the context of the pandemic how it's relevant for infectious diseases. And it's a fundamental tool also for improving patient safety and better self-care. One other issue, however, that I would like to bring to the fore to start the conversation is that we need to have a view in the definition of literacy, which is not narrowly focused just on the knowledge that individuals have alone. There is a broader questions about health systems, the organizations, the professionals as well, even the media and policy making, and the role that they have in providing information which is scientifically robust and sound and correct, but also that makes sense to people, that is easy to access, and that can be acted upon, can be evaluated by people and support. And that includes both information on health, but also information about different difficult things like what does it mean as exponential growth of an infectious disease in the context of a pandemic, for example, or even how do we help an individual navigate an increasingly digitalized health system. I think those are all issues that probably we will be discussing.
And a quick question, just a quick fallback on that. And Ilona, if you could respond to this too. What about the cultural differences that we have? I mean, does one size fits all for health literacy, or does this have to be tailored by region, country? Francesca, first for you. I mean, how do you manage that?
It's a really mix of both, in the sense that, if you're talking in absolute terms about the critical importance of providing information that can be acted upon, there is a fundamental issues of making sure that you do it, that policymakers, the providers, and so forth do it. But there is then obviously a matter also of tailoring it to the specific conditions of different countries, to what really makes sense to people, which can be very much of a local also exercise.
Ilona, anything to fall back on that, or any other comment?
Well, definitely, Yuan, and we've learned that also in the context, for example, of the Ebola outbreak, etc., that, health literacy is not just an individual issue, it's a community issue, and we often speak of also community health literacy. And of course, any kind of information-based intervention, if I can call it that, has to be context specific. Otherwise, you will not be successful. I think we've learned that over the decades, and it's a message that health promotion has always given very clearly, that things are not just about individuals, they're about context, they're about groups, they're about cultures. So in relation to that, yes, I would fully support what Francesca has said.
Picking up on that, in 2013, you co-authored the WHO's Solid Facts About Health Literacy. Obviously, we're almost 10 years on now. We're dealing with a pandemic. What has changed since then, and what lessons do you think also carry forward?
Well, Duane, there have been enormous changes since then. I mean, the most obvious at first sight is, of course, the whole development of digital health, the role of social media now in relation to health literacy, but also all kinds of tools we now have to help people navigate their own health or the health system, wearables, apps, etc. So first of all, there's a whole new universe of tools and of contexts and how you can get information as an individual on the one hand, and how you can provide information as an organization or institution on the other hand. The second big change, of course, are the issues. At least in our part of the world, there was a tendency to look at health literacy mainly through the eyes of navigating the health system, and Francesca is related to that, and non-communicable diseases. And of course now health literacy in relation to infectious disease, vaccination, antimicrobial resistance, a whole range of new kinds of issues has come to the fore that we need to include. The third thing I think we've learned is the synergistic nature of health literacy. So going back, to some of the things I've just said, when we speak about health literacy, we now include digital literacy, we include science literacy, we include what I call civic literacy, how you communicate with each other about health. For example, on social media, that you're willing to listen to one another. And here, given what Francesca has said, we see again this very strong interrelation between general education and health literacy. She referred to, numeric literacy, understanding percentages, exponential growth, all of those things you would have hoped, the normal education system would have helped people with, but we see a failure there. And my last point really is how political health literacy has become. Some people are even saying that health information is becoming weaponized. Political positions are taken, people attack each other with health information, with misinformation. So it's a totally new health literacy environment out there.
Yes, and boy, there's a lot we can pick up on that. I would like to point out, ladies and gentlemen, we have two exceptional speakers. It's rare when we have two people of this caliber. Please, if you have a question, submit it, and I'd love to get it out to the panel. Ilona, picking up on something both you and Francesca just mentioned about digital, I think 10 years ago, 8 years ago, when we spoke digital, we were talking EHR systems, electronic health records, but now we're talking Twitter, Facebook, social media. How do we handle, what are we going to need to do to get around the sort of din of noise that's being developed around social media? I mean, this has been obvious around the pandemic. Francesca, coming back to you, I mean, how do we actually manage that from the diffuse nature of information and the problems we've seen?
Well, sure. I mean, as a first thing, of course, in absolute terms, the fact that there is information around is not necessarily a problem in itself. You know, that it depends obviously what information is provided and in what ways it is provided. But it's a reality, and alluded to that now digital health is becoming an integral part of our life. And I look back actually at some of the figures that we had from a few years ago about people searching for health information. Is now as much and is as common as searching for information about e-banking or online courses or e-shopping and so forth. So that's a reality. Is it a problem? I think the question becomes, is it good or is it poor information? And is it information that can be trusted? And clearly there is a role for governments. There's a role also for the online platform to make sure that the information which is communicated is used and instrumental to increase the level of digital and health literacy, so the skills really of individuals. There are ways also that you can act to support the fact checking, for example, of the information which is provided, or also facilitating the use of human moderators so that you can place into context the information and facilitate really the reaching out to information which is accurate. So there are ways that you can, in a way, work in this environment in which there is both good information and misinformation by supporting the digital and health skills of populations, but a clear also role and responsibility of the social platforms as well as governments in trying to address this journey.
So Ilona, do you agree? Can we just use basic education and numeric ability to get over the din and noise of social media? Do you think that's possible?
Oh, no way. I mean, it's one part. Of course, every society should have well-educated people, and education is a human right. And so, of course, we want to see that, but it is definitely not sufficient. And it's not sufficient in an environment where digital has actually become a determinant of health in itself, how it impacts on health of young people, for example. And the OECD has done interesting studies on mental health and young people and digital, which can be very worrying. What we do see, and I'd like to underline that we do not have enough regulation of the digital health information sphere. And that relates, to the big platforms, but also to a whole number of startups and entrepreneurs, etc. This is a big new money frontier, health. And if you look at how the big tech companies are entering the health arena, both in terms of providing services, providing information, using health data, actually using health data for other purposes, rather than the ones that they say this is about. So if people go on to find health information and give information about themselves, they do not know what happens with their data and what it is used for. So it's a very, very big new universe that legislation, quality control, absolutely essential. So this also gives new roles for regulators like, the FDA in the United States, for example, the health insurers before, they launch things or buy apps from people. And, it's talking to some of the app developers, it's actually extraordinary, on the one hand, how creative they are, but how negligent of context, that they are. They think, an app will solve something. An app alone will never solve a problem. And, here there's a lot to do over the next 5 to 10 years.
Yeah, and if I can pick up on that, there was just a leak of an interview with someone from CNN, and they're using the health information basically to try and make people scared so they get more eyeballs. So there's even manipulation from big
Yes.
media, which we do need to be concerned of. Got a litany of questions that have come in. I'd like to start here with a question from Mark Dumont. Thank you, Mark. It's ironic that we often struggle to explain what health literacy is to both staff and citizens. How do we overcome this? And if needed, is that necessary? Does the panel think that's necessary? Francesca, I'll start with you. Do we need to explain what it is?
Well, it's a question whether you need the definition or not. I mean, yes and no, you need to know what you're talking about, but the fundamental question is then how do you get people to act upon? And it's not just, the individuals themselves, is, the providers, the role of governments, the role of regulators, as Ilona was referring to, that needs to be addressed. So yes, we can easily, have a definition, just done the definition, but let's move then to the issues of what is the content, the type of information we're talking about, what are the means of achieving literacy in this broader consideration, which is not just the narrowly thought health literacy in the context of chronic conditions, but really like a wider spectrum of digital health literacy, ability to function and navigate the complex social media and platform environments and so forth. That requires a lot of skills that needs to be built upon, which is go beyond just the providing of accurate information.
So Ilona, how do you put a health literacy plan in place internally in an organization effectively? What do you need to do?
Well, first of all, you work with everyone in the organization. You don't do a health literacy plan from, the top down. You try and find out what is important for people. And you do a plan that is not only just based on individuals and additional skills or knowledge they would need, but you would look to how your organization can actually support individuals, especially people in your organization with lower levels of health literacy. Because we will always have that interface between, what are skills we can provide, how can we, increasingly skeptical of the word empowerment, but basically, how can we give people knowledge and tools to make healthy choices? And, this has been the start of our thinking. Nearly every choice today, nearly everything you do today has some kind of health relevance. Whether you go for a walk, what you shop, how much you sleep, what you do on the internet. And the issue is, how do I help people make healthy choices? And some of that is about giving them skills and knowledge, giving them easy access if they have a question. But then the question is, what's the healthy environment? What's the information environment I give to them? And, just take a supermarket and then think about that, what you need in terms of the interface of individual knowledge of a mother that goes to shop there, and what the products promise that she would get in terms of health if she picks that from the shelf. So we need to address those kind of interfaces.
You mentioned earlier apps, and we're very fortunate to have an app specialist on the call with us today. We have Leo Exter, who submitted a question. Thank you, Leo. How much is behavioral science being used to understand patient behaviors and shape the tools of patient information accordingly? Are we using behavioral sciences? Francesca, at the OECD, are we incorporating behavioral sciences into these plans?
Probably not enough as yet. I think there is increasingly more attention to issues of behavioral science, so how individuals, think, act, react, and so forth. But there is a long way to really understanding from that point, how and how the tools should be designed, how the policy should be designed in a way that really is conducive to the behavior that one wants to have. So I think there is increasingly more attention to that. But even in the context of the current crisis that we are seeing, the issues of how the information, for example, is communicated in a way that is easy to understand, but that can be acted upon in the desired way. And so the whole questions of behavior of individuals becomes particularly critical. And you could, in abstract terms, see exactly the same tools, the same information being communicated, but reactions being very different, depending on individuals. And depending obviously on groups. And I think it's fundamental to understand that dynamics a bit more. It then goes back to the issues of how, even governments, regulators build trust from populations around health issues, about directions the governments give and so forth. And it's a critical issue if you want to achieve the kind of behavior that is conducive to improvements in outcomes and to the objectives that policymakers want to achieve. But again, there is perhaps a mismatch, or still a long way, a gap to go in building that level of trust that will really, convince or lead people to act in certain ways. And that goes beyond even the issues of communication, communicating clearly in a scientific-based matter. All of that is fundamental, addressing the misinformations and support. But building the trust requires much more in terms, for example, of making sure that there are strong values, that people understand that there are strong values that motivate certain policy interventions of behavior. Are those values about fairness? Are those values about openness, about what governments are doing, to what extent integrity is taken into account and so forth. So I think there is a whole spectrum of policy levers as well as policy duty to really build that trust that require really significant action.
Thank you. And I'd like to link that to a direct question related to government, this sort of idea of linking those gaps. We have a question here from Hannah Horka from DG Santé. Thank you, Hannah. What are the biggest gaps currently at the EU government level related to health literacy? What do you need to do first? That's a good question. And she also points out the EU Code Against Cancer is an important source of information, but I have no illusion that people know about it. Thank you very much, Hannah. We do want to discuss the cancer plan a bit. Ilona, what are the current gaps between the EU and the government level, the local level, and what do you need to do first?
Well, I think what you need to do first is to create a healthy environment for people. So for me, one of the really critical things around health literacy is, for example, nutrition information, is labeling of goods, is building trust that what you buy is what keeps you healthy, and that health promises. One of the things the Commission did deal with, that health claims of goods are reliable. So I think the really, really important thing also in relation to the cancer plan are issues like, how much fat or sugar is in a certain product, and what about tobacco smoking, and a whole range of issues that need to be dealt with then with industry. And we have sadly, the experience that voluntary agreements have not worked. And this is where health literacy gets political in another way. We've talked about, the politics of the vaccines and the whole COVID-19 situation. But, we've had that kind of political dimension of health literacy for the last 50 odd years, trying to regulate issues that actually cause cancer. And I think this is where the European Union and the Commission in particular as a body that can regulate in these areas, is absolutely critical.
Thank you. And Francesca, you obviously leading the OECD's work on health literacy, you focused on non-communicable diseases such as cancer. That's tough to say this morning. What specifically do you think we could do more about cancer related to these gaps?
Well, I think some of the issues have already been mentioned, but I would agree very much with Ilona that you need to address the fundamental building blocks, so the social determinants of health, and how you make sure that there is a healthy life, that you address issues of the way how we eat, how we move, and so forth. So I think moving upstream very much is a fundamental issue, and that requires obviously informations and health literacy, as well as addressing a number of other tools, government regulations, and so forth. So I think that's for sure, that's the starting point. Then things about, once you've addressed the upstream determinants of health and more the prevention, the public health aspects, there are then the issues of what happens for people who are attained by cancer, what's the role into the decision-making processes. Do they have the right information? Is the doctors, the health professionals, the entire health systems relating to that individual in a way that is conducive to improved outcomes? And by outcomes, I mean also the quality of life, of course, of individuals. So it's like moving again and going back to what was mentioned at the beginning, to a more people-centered health system in which there is a shared decision-making processes about what could be some of the consequences of different choices. That becomes quite important as well. But it's quite clear that the first thing to be done is to address the fundamentals, so the social determinants and the prevention and public health aspect.
Yeah, and one of the points about the tools as well, Europe's Beating Cancer Plan currently plans to give information and tools they need to make healthier choices, scientific developments, new evidence, recommendations, et cetera. And part of the plan is to make 80% of the EU's population aware of this by a mobile app. Do you think that will work just on its own, or what do you think we need to do to lay the groundwork to make that happen? Alona, from your perspective, do you think an app is the way to go, or does this need to be far more integrated? What do you think about the current strategy as it's laid out?
Well, Duane, as I said before, one tool alone will never solve a problem. I mean, a tool can be incredibly helpful. And of course, a tool that gives a consistent message throughout the European Union could also be very helpful. But, I live in Switzerland, and there's the famous Swiss cheese model of prevention, which is that, any good public health strategy has a whole range of factors. And so, if one part of that model, and, you have to think of an Emmental cheese that has holes at various points. So if something goes through hole one, it is actually stopped by the next slice of cheese, which has the hole somewhere else. And that means, you need measures related to education in general. You need the social determinants and, those kind of measures where you make choices in life. And again, I come back to the importance of food and cancer. Alcohol and cancer. I mean, those are absolutely critical issues. And then, of course, you have maybe an app, and hopefully a good app, where people can go to find information if they are unsure of something. But, if I'm a mother and I stand at the supermarket cashier, and every unhealthy good under the sun is next to it, and my child screams for it, then, the best app in the world is not going to help me. So, we need different kinds of rules. And here's where behavioral science comes in. This is where, our knowledge about nudge strategies, about making the healthy choice the easier choice, becomes really, really important. And I wish we would just use that knowledge. We have so much knowledge in the behavioral sciences, in psychology, in the social sciences, you name it. And we do not apply them because there are a number of forces that do not allow that these kind of tough political decisions are taken. And I do wish, that also the European Commission is able to become more courageous as one builds a European health union.
We're almost out of time, ladies. I'm going to ask one final question to both of you. Francesca, what's the quick win here? What's the one thing that should go first that could actually help with health literacy? If you could make one recommendation, what should we do first?
Well, I would go back to the issues of taking a broader perspective, addressing really the social determinants, not focus just on the end point. I think that's for me a fundamental issue. But also not think perhaps that you just can have a quick win, but rather being coherent and broader strategies. So sorry, I'm contradicting a little bit what you're saying.
No problem. It's not the first time. It's okay. All right. So there's no quick wins. Alona, from your perspective, what's the one thing we should tackle first?
Well, let me underline that, one of the problems in public health, particularly when it comes to political decision makers, they always want the quick win rather than the Swiss cheese model. So I think, one quick win would actually be if one got policymakers to think differently. But if you do want one issue that I think would make a tremendous difference, it's reliable nutrition labeling throughout the European Union.
Ladies, thank you very much for your time. It's been a great pleasure. I'd like to thank you for your participation. I'd also like to thank Merck Sharp & Dumb for their support. I'm Dwayne Schultes from Managing Director of Vital Transformation. I'd like to thank you all for your participation. We had more questions we could get to. Until next time, have a good morning, and thanks, everybody. Bye-bye.
Bye-bye. Thank you.
Bye-bye.